this, we're taking 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 with a pinch of salt.
Dear colleagues, welcome to A Pinch of Salt, where we try to explore critical topics in nephrology. I'm your host, George Kosmadakis, and today we'll focus on the essential role of vaccination in patients with chronic kidney disease. As nephrologists, we know that individuals with CKD are at heightened risk for infections, making timely and effective vaccination an action which is vital for their health and well-being. In this episode, we'll discuss which vaccines are recommended, the unique considerations for patients at various stages of kidney disease, and the impact of immunosuppression on vaccine efficacy. We'll also hear from a leading expert in the field who will share her insights on best practices for immunization in CKD, addressing common challenges and misconceptions. Our guest today is Professor Nina Babel from the University of Bochum in Germany. Nina, welcome to the Pinch of Salt.
Thank you, George, for inviting me. Thank you so much.
So I will start straight away with a very naive question. Why should I bother to vaccinate CKD patients? In any case, do they respond? Are they even protected by the vaccinations?
Okay, a great question. Thank you. So let's start probably with the question: should we bother? The response is clearly yes. Infectious diseases are the second leading cause of death in patients with chronic kidney disease, and vaccination is known to prevent infection. And actually, as a preventive measure, vaccination have saved more lives than any other medical intervention so far. Concerning the question, do they respond? Here I would like to stress that we mostly talk, if you talk about their responsiveness to vaccination, mostly we talk about serological response. We looked for the production of antibodies, but in fact, we have to talk about not only serological antibody response, we also need to talk about cellular response. Both type of response are important. I would like to elaborate a couple of minutes on this topic because antibodies are really important to prevent their pathogen entrance into the cell host. But cellular immunity, T cells, they are important not only for the generation of antibody, they are also important for the killing of bacteria of the pathogen. Therefore, we not only need the antibodies that prevent the infection, we need cells that prevent the severe course of infection. In fact, if you think about the previous pandemic on COVID-19, we have a subgroup of patients that are not able to produce antibodies, as patients with common variable immune deficiency. But these patients, they were completely okay after vaccination because they didn't develop a severe COVID-19 because they were able to mount a specific or a high level of specific T cells against SARS-CoV-2, and they help to prevent the severe cause of infection. So if we talk about CKD patients, it's important to distinguish what patients we are talking about. Then they have different degree of immune surveillance. We can talk about chronic kidney patients with chronic kidney disease not requiring renal replacement therapy, and patients that require renal replacement therapy, that are patients on hemodialysis or transplant patients. And let's start with CKD patients that do not need transplantation, don't need immunosuppressive therapy. We know since a long period of time that patients that have a chronic kidney disease, they experience a degree of immunodeficiency, and this immunodeficiency is due to different causes. First of all, they accumulate some toxins and uremic solutes. They have oxidative stress. They can respond to dialysis membrane, the biocompatibility of this membrane. They have also other factors, including EPO deficiency, iron, vitamin D deficiency, and other comorbidities. And they all factors lead to the phenomenon we called inflammaging. That inflammaging includes chronic inflammation. These different kinds of factors I told you before, just talked about it before. They lead to the low level of chronic inflammation, and they cause exhaustion of immune system over time that weaken the body and diminish the effectivity of prevention of infection. On the other hand, we have also premature aging of immune cells. And there is a study showing that patients with chronic kidney disease, if you look at the T cells, the T cell showed the age of T cells that is actually 20 to 30 years older than the actual physiological age of the patients. So these factors compromise immune function in chronic kidney disease patients that are not under immunosuppressive therapy, and they are at high risk for infection, and that should be monitored and should be applied preventive measure like vaccination.
Right, right. So I liked very much the inflammaging. It shows that the aging is a disease. In fact, and effectively, patients with chronic kidney disease present a generalized accelerated process of aging, and including immune system. And that guides to the next question. What about the kidney transplant patients? Are there any differences with regard to vaccination? I suppose you could say transplant and immunosuppressed patients with that have needed immunosuppressive treatments for their primary renal disease.
Yeah, completely right. It's of course we also have patients that need due to vasculitis, any other kind of autoimmune diseases with their also with their renal disease. So for these patients, we need to tell that the patients they are under suppressive therapy. They have much higher level of immunosuppression. The patients under the immunosuppressive therapy, the immunodeficiency is much higher than the patients with that just have chronic kidney disease and do not receive immunosuppressive therapy. And therefore, these patients have some restriction with regard to the type of vaccination and some consideration with regard to the time point of vaccination. To be more precisely, the patients that are under immunosuppressive therapy, they are not allowed to receive vaccination with a live type of vaccines. I will and also, if you talk about the time point of vaccination, we have to give the vaccination to these patients not immediately after transplantation, because at the time point of transplantation, the amount of immunosuppressive therapy that the patients require in order to prevent rejection is much higher at the later time point. Um, Coming to the question whether they respond to their time point, or if you would like to ask me at what time point of their chronic kidney disease or after the transplantation should I provide the vaccination, I would like to tell you that the time point should be as soon as possible, because uh, um, um, if we know from the previous studies that the immunosuppressive drugs inhibit generation of primary immune response in naive host, and the responsiveness after the vaccination, if the patient do not see pathogen before, is a responsive to the of the our immune cells. It is low, much lower than if we have already the second the memory T cells. It means if we have already establish a primary immune response after vaccination, and then we apply immunosuppressive therapy, the patient, if they meet to the pathogen at a later time point, the effect of immunosuppressive therapy on the secondary immune response is much less affected. So therefore, we recommend to provide vaccination before the start of immunosuppressive therapy. But in some cases, we are too late. We have already transplanted organ in patients. The patients already after transplantation, just to the fact that the intensity of immunosuppressive therapy at this time point is lower than at the beginning after transplantation. One exemption is our seasonal vaccination, where the need of vaccination depends on season. I'm talking about influenza, RCV, and COVID-19 vaccination.
Right. So we should give some time for the T memory cells to be produced, and this is the theoretical image of the piece of advice that says vaccinate your patients as early as possible in the course of the chronic kidney disease before they
Right.
need to be immunosuppressed in a transplant process. And you provide advice that we should wait for a minimal immunological tolerance to the kidney graft in order to vaccinate the patients later when the burden of the immunosuppression is much lower. So, well, the situation is very clear. And which are the vaccines you would recommend in the various stages of CKD based on this information?
So actually, as I told you before, the recommendation to CKD population are actually the same as for general population, with exemption for transplant patients where their live vaccine are not allowed. um, it's just to the risk of the outbreak of the infection, so because their immunosuppressive therapy can just diminish immune response, and this live vaccine can just go in some cases, just to avoid it, could lead to outbreak of the infection, and to avoid this, the live vaccine is not allowed for patients under immunosuppressive therapy. But what are the vaccines CDC or KDIGO recommend to patients with chronic kidney disease? As I told you, as the same as for the general population, as MMR vaccine, varicella vaccine. Again, they are live vaccine, and they're not allowed for patients after transplantation due to immunosuppressive therapy, or maybe other patients that are with CKD and under immunosuppressive therapy. Then tetanus, diphtheria, pertussis, polio, Haemophilus influenza B, HPV, pneumococcal vaccine. Maybe at this site, I would just like to stress that before we vaccinated pneumococcal against pneumococcal with 13 valent vaccine, and then we had to wait at least 2 months, and then we have to repeat the vaccination with pneumococcal vaccine 23 valent. Other way around, if we have already pneumococcal vaccine 23, we had to wait 1 year and repeat with pneumococcal vaccine 13 valent. And since the last year, we have approved a new vaccine. It's a 20 valent vaccine, and one vaccination is enough, which is very nice. We need just one vaccination shot. We have also influenza vaccine, COVID-19, and RSV. It's a like seasonal vaccine. We have to repeat every year. With respect to diphtheria, tetanus, diphtheria, and polio, it's every 5 to 10 years. And HPV, we have to measure antibody response and look at the response. And if their serological titer goes down, we have to repeat the vaccination. So there are also optional vaccination. They are associated with different travel. And we also hear patients under kidney with chronic kidney disease and under immunosuppressive therapy can receive this vaccination, but we have to look whether this vaccine type is not living vaccine. They are not allowed again.
Yeah. Thank you very much, Nina, because you just answered a question that I had from a registrar yesterday, and he asked me, um, we are looking at the list of vaccinations recommended, and it says for certain populations that we should vaccinate in one way, and for immunosuppressed populations in another way. And he told me if CKD patients are considered immunosuppressed, we should consider them as a special group. And I told him, well, there will be a podcast tomorrow, so you will listen to Professor Babel and you will have your answer. And the answer, dear colleague, dear registrar, is that the patients with chronic kidney disease without immunosuppression are vaccinated like the general population if they don't have any immunosuppression, active immunosuppressive treatment. So this is very useful, and it can clarify some sources of confusion. And now, I always like to make projections. And do you make any projections? What will happen with vaccination landscape in the future? Do you have any visions on this?
Well, future vaccination strategies are likely to evolve response to advancement in science, changing global health needs, and lessons learned from the past pandemic. And what I could imagine that we could, first of all, provide a personalized vaccine as everywhere. We're talking about personalized medicine, personalized diagnostic, and so on. In the progress in genomics and precision medicine, future vaccines may be tailored to individual genetic makeup or specific immune system profile. It would be nice. It would be possible to go through the immune system, look what patients are missing, and provide the effective and targeted immune response. Further, we are right now also working, not we are the whole world, working on research focusing on developing universal vaccines that offer protection against multiple strains of a virus. For example, I'm going to force to create universal flu vaccine or universal coronavirus vaccine that could provide long-term immunity for all strains, and we do not have any needs for annual updates. We can also take advantage of mRNA and next generation platforms. The success of mRNA technology during the COVID-19 pandemic has paved the way for further innovation. So, further vaccines might leverage mRNA platforms, not just for infectious diseases, but also for other conditions like cancer or autoimmune disease. And these platforms could allow rapid development and easy updates in response for pathogens mutation. Maybe we also need to work a little bit on portable and thermostable vaccines that can be transported more easily and stored more easily. And maybe we can provide kind of combination vaccines or one-shot vaccines that include all kind of required pathogens just with one shot. Uh,
A mega vaccine.
yeah, that's a mega mega vaccine.
Right.
So maybe at the end, just to empower patient to do it by himself, maybe provide a kind of vaccination that patient are able to give the vaccination by themselves. Would be nice at home.
Well, this is very fascinating. This personalized, tailored vaccination, evolving RNA vaccines, vaccines with long-term effects, vaccines that can be stored without specific precautions. What an exciting perspective we can see in the vaccination strategies. I liked very much the tailored, personalized stuff. Well, thank you very much, Nina. And now I will pass on to our usual personal question that we ask all our guests, and it this is that if you were in a desert island, which book, luxury item, and two songs would you take with you?
Okay, so as a book, I will take their book, The Eighth Life by Nino Haratoshvili. It's a Georgian author. She wrote this book in German, so I read it in German. It's a family saga and the great epic drama going through the whole last century and describes the most important historical events in Russian Empire, Soviet Union, and whole Europe. I enjoyed this book very much. So I would recommend also other to read it if I need to recommend.
Yes, of course, of course. And what about the luxury item and the two songs?
Oh, yeah. The luxury item. Well, I'm a very I like luxury and comfort, and it's tough to take one piece, but maybe I will take a communication device. I like information, like to be informed and communicate in communication device that are driven by high-end solar-powered satellites. So because I'm in desert, so I can get power from the sun and to stay in communication with the world. And two songs you asked me also for two songs. It will be the
Yes.
one will be it's "Хорошо, все будет хорошо." It's a Ukrainian singer. I was born and grew up in Ukraine, so it's saying about it's a very optimistic song. "Хорошо, все будет хорошо," meaning good and everything will good. And another song will be by Leonard Cohen, "I'm Your Man."
Well, you take part of a big minority of other guests who like very much Leonard Cohen. I like it very much as well. And you are very reasonable in your luxury item because some others have asked for a pillow.
Oh, yeah, that's true. But communication is very important. Yeah.
Of
Mm,
course, of course.
mm.
There are some others who are reasonable as you and ask for devices like this. Well, dear colleagues, as you see, the horizon concerning the vaccination practices is evolving. Vaccination is an important task that nephrologists are taking very seriously. We shouldn't forget the potential number of lives saved thanks to the prompt mobilization of the renal community worldwide, especially during the COVID 19 period. Stay with us with more podcasts in all the available platforms. Stay safe.